Welcome, welcome. Feel free to join. Phenomenal STEMist. Let me know if you can hear me. I believe I can. I heard the mic on there. I have the privilege to be in Colorado. So the next best secret is the dentistry field, but the number one profession in STEM is the science professor, just to let you know. We're always off. And the spring break has been very relaxing in Colorado. And I'm staying at a friend's house, Dr. Simone Webley, and her husband. You've met him before, Howard Webley. He was the microbiologist, if you remember. So I'm interviewing her live from Colorado. Yay. And I'm going to ask you one question. The first question is, when did you fall in love with your discipline?
It was probably, I went into college knowing that I wanted to do biology, but the main reason was because I wanted to be a physician, and biology was just the most straightforward way to get there. There's a lot of other things. Like when I was growing up, I wanted to be an air hostess.
Air hostess?
Yeah.
Okay.
So they called it back then. I don't know what the proper terminology
Stewardship?
is.
Stewardess?
Stewardess, right.
Okay. Okay, you must have been born in Jamaica.
I was.
Okay. We call them stewardess in America. Okay.
Yes. And I got deterred from that and decided, I think it was actually watching the Cosby Show, as a matter of fact. And it was one of the episodes when they were talking about Bill Cosby and him being a obstetrician gynecologist.
Yeah.
And I was just like, oh, that should be cool. I didn't know that I wanted to do the obstetrician gynecology part, but just the whole working with kids part, because I loved kids. So I was like, maybe I should be a pediatrician. So that's kind of how the love formulated. Right. And Cosby Show was what, 90s?
84 to 92. Yeah.
Okay. So I watched it a little bit later.
Yeah, Jamaica come on later.
Right. But yeah, so I guess that's where the love of it came from.
Mommy, I need this at the service.
Go ahead, sweetie. No, up there. No, put it in mommy's room. Okay, come.
That's the beauty of, listen, women in science. We're talking about women in science all month long. And you just can't know. For the fathers, for the past 2 months, I've been able to separate the fathers from their children. You can't do that with women in science.
They'd have to be in bed, and then you guys would have to watch this at like
late night.
o'clock.
So too late. Okay. So you fell in love. You knew you wanted to be you didn't actually know you wanted to be a dentist.
No, definitely not dentist. It was pediatrician at that point.
Yeah, but you knew you wanted to be in STEM and, a professional in the medical sciences.
Right.
By shout out to Bill Cosby. I know he's going through some stuff right now, but same thing with me. That was one of the first shows that helped me see my dream. Okay. What tools did you use to discipline yourself to succeed?
One of the main one, and this one might be a little bit weird, was my grandmother. So remember I said earlier that I was
Emil, come here. Come.
Remember I said that I was deterred from being a air hostess. Thank you, sweetie. So my grandmother was the main deterrent. She had this thing where she was just like, what? In our wonderful Jamaican dialect. She was like, you want to be a what? She was just like, you need to do X, Y, and Z with your life and find something better. And that was the first thing. That was the main deterrent. And then as far as the studying goes, we used to enjoy watching television, and she was not having it. She was just like, they have what they have already. You need to go take up a book and read, and you need to go put something in your head, because you're watching all these people, and of course the soliloquy or the monologue that we got was a whole lot longer. But she was just like, get off the TV, go study, go do something else. So those were initially my main deterrents. And of course, once I got into school, It was just, I didn't want to waste anyone's money because I wasn't paying for it at that time. It was my mom that was doing most of it.
Right.
And I wanted to make sure that I didn't retake anything. And so I had to do it the first time and get it done. And I don't think I ever retook a class.
Listen, so you had a disciplinarian in your family.
Yes.
And be that from your grandmother, and you had a respect for your mother's money.
Right.
You know, they were paying for you to go to school.
Right.
You didn't want to waste their money. You didn't want to waste their dreams. They had high expectations. I think that's so important that we have high expectations of our children. Hey Pierre, how you doing? Spendy, what's going on? Good to see you guys. But yeah, high expectations was pretty much enough for you to say, this is, I'm gonna stick to the books.
Yeah.
I can dream I can fantasize about being a doctor, but the reality is I gotta work at it.
Yes.
I can't just have the dream of being a doctor.
Right. And it required work, and we kind of knew that. So when my mom got here, we got here when I was about 11 years old.
Okay.
And then she had to, I don't even remember what the initial job she was doing, but she took the courses for go ahead and eat it. You can eat it upstairs. Go ahead. She took the class to be a CNA. And it was, it was rough. Like, she was a seamstress in Jamaica. And I know she told me that she worked in like a hot pepper factory at one point at time. No, eat it upstairs. And she told me the story about how she came home and her hands were just I think she was allergic to the peppers that she was working with. So her hands was just burnt up. So she couldn't do that anymore. And she had to move to the seamstress. But she came here and she worked hard. CNAs don't make a whole lot of money, but we never lacked for anything. Like, we didn't know we were poor. We were just like, she still gave us the video games. We still got Christmas presents every now and then. But she also taught us not to be, we weren't like, Mommy, what are we getting for Christmas? We never did that, because it was just like, if she gets us something, great.
Grateful.
If she doesn't. But she did what she could to make sure that we were well taken care of. Shout
out to the immigrant parents that come and they don't have all the education as some people say they must have. It's amazing. Like my father came here and was I'm not to put you out, Dad, but he was a dishwasher in this country. Your mother was a CNA. They didn't have the education necessarily to be
couldn't help us with homework,
but they had a motivation for us. They had a motivation for themselves. My father didn't end up with a dishwasher. He became a teacher and things like that. But my point is, a lot of Americans feel that immigrants have to come here already set. But I want the world to know that immigrant parents may come and they may do menial positions, but their children become dentists and PhD scientists. You hear me? You feel me? So shout out to the immigrant parents that really push their children to succeed, to be excellent, especially in the sciences, which you did, and you had an honor for your mother, and that's one of the things that helped you discipline yourself to succeed. Okay, I love that. What were your challenges in school?
Challenges in school. Gosh, I think it was more so like peer-to-peer interaction. I wasn't the most friendly person. Why are you laughing, Maya? And I guess it helped to a certain extent. And part of it, again, was my grandmother. Like, I wouldn't do some of the things that my friends would do. Like, I'd have friends that would sneak out and go to the club. And they'd be like, Simone, you coming? I'm like, well, you crazy? She would kill me. Even though she didn't know, she would find out. But it was just more so those kind of interactions. And I feel like, to a certain extent, I kind of feel like I missed out on some of those, just going out and having fun and doing some of the things that my friends did. Like, I wouldn't go to the clubs. Once in a blue moon, I got to go to a party. It had to be like a house party with I think we went to like a track teammate birthday party type of a thing. But those were the main things. As far as doing the actual schoolwork, it wasn't too bad because I tend to try to stay on top of things as much as I could, and didn't try to miss things. So it was more those kind of interactions I think were the challenges.
Okay. So you weren't the social butterfly?
No, I was not.
And so you did well in school, but you didn't feel like you had the college life experience that many college students have because you want to. Well, okay. That's different. That wasn't usually a challenge that I've heard before. Yeah. But okay.
I mean, it could have worked for the benefit.
It did.
Went to some parties and
got
and I
in
didn't
trouble.
drink and I didn't smoke, didn't cuss, didn't do all of that. And it was just some of my friends. I had friends that got pregnant. As a matter of fact, and I won't say any names, but one of my roommates got pregnant.
Yeah.
And we actually had decided to move in together for sophomore year because my mom said it was okay to move off campus.
Off campus.
And moved in together. And my mom, she found out she got pregnant, and my mom came down there and rented a U-Haul and moved me out.
Oh my gosh.
She was just like, let's go. You're not, and
so it worked for your benefit.
It did.
Yeah, it worked for your benefit. But it still was a challenge for you because you obviously wanted to have a little bit more of a social life in college.
It would have been nice. But I probably was a little bit awkward as well, so I didn't know how to. It was just like, some of the foolishness that I saw them doing, maybe I would have tried it here and there, but then I'd have been like, that's not me. Yeah. But Emil, you gotta stop or else you gotta go upstairs. Be still. Thank you.
Motherhood. She has 4 children. Yay. And she's a dentist. Okay, you can do both. It's doable. It's doable. It's a little different, but it's doable. So what are your challenges now? First of all, tell me what you do for a living.
So I'm a dentist, general dentist. And in dentistry, you can actually be a specialist in, I think, 8 or 9 different areas. But with general dentistry, you can technically do any part of that you want to. So if I want to focus my practice to all root canals and just be a general dentist, I can do that. But once you specialize, you pretty much then are focused on what you specialize in. But I like doing general dentistry because it just keeps kind of my hand in everything or anything that I'd like to do. And if I don't like to do it, then I stop doing it. You're going to get in trouble. Okay. So right now I work for a not-for-profit company that sees HIV patients. That's one of the criteria for them to be there. And then they have to be at or below the poverty level. So it's pretty much an underserved community that I see. Wow. And we do just about everything and anything on them that's within the scope, Emil, stop, of dentistry, except for implants, pretty much, and really, really hard extractions. We send those to the oral surgeon so they can have fun with it. But that's the gist of what I do. What did you do? Okay.
And so, which I think dentistry is the best kept secret.
Yes,
I think it's the best kept
especially secret. If you're a woman, want a career and the family. It is so a wonderful career to have.
Yeah, but let's talk about, before we talk about the greatness. Okay. What are your challenges?
Yeah. Gosh, my challenges. Stop me. I think staying on top of, it's nice to have a career. Right now, the place where I work, we close at like 4 o'clock, but I have to get home and take care of the kids, get them, dinner, get them to bed, spend time with them. So that can be rough at times. And with 4 of them, and mind you, they're like 2 years apart. Yeah. The oldest one is 6. And that would be great when they're teenagers and they can do their own thing. But right now, as you can tell, this one is trying to act like he has nothing else to do. Hey, why don't you
This is Emil Webley.
Say hi.
Hi.
Go ask Daddy for the laptop and see. Just ask him. No, go upstairs. You can reach it. Go upstairs and ask him, and then Daddy will give it to you and you can watch something on there. All right. Thank you.
Good one. Good one. See,
Yeah, we'll see.
See. So you tell them to go get the laptop. That's one way to get rid of that. Yeah. So work-family balance is when you
right. And as far as just work is concerned, when you work as a general dentist, it's just a matter of you have to decide, what you're comfortable with doing. And sometimes, depending on your personality, you can get into herodontics, which is where that tooth really needs to come out, and you're so hard trying to save it. And you do all you can to save it, and then the patient turns around and they're just like, oh, now I have to lose my tooth and it's your fault. And it's just like, but I told you in the beginning that it was a stretch to try to save it, and we're going to do all of this stuff. And, so making that balance of deciding, just pointedly telling a patient, no, we cannot save this tooth. It needs to come out. Because, of course, you'll get tears all over talking about how they just don't want to lose any more teeth. And they try to put their stuff on you, where it's not on you, because it's their decision to take, 5 years to come in to see you. They know they were having pain from however when, and now they need, a root canal, or they bit down on something and it cracked the tooth, and you can't say, they try to put their stuff on you when it's not your fault. It's on them. So you have to figure out how to, I'm gonna give you my phone in just a minute, okay? Hold on. You have to figure out how to make sure that they understand that this is your issue, your mouth, and I'm just giving you my recommendations, and you get to decide whether or not you want it. And I've actually had to tell patients that, like, advocate for them to advocate for themselves, just to help them to understand that anyone can recommend anything to you, but you have to determine if this is the route that you want to go with your mouth. It is your mouth, and you are entitled to do that. So sometimes that's rough, because they really try to, get you to say, well, this is what I would do, or this is what you should do. And then, not all of them are grateful in that they're just like, okay, this was your suggestion and I decided to take it, and maybe it didn't work out or something. Some of them are really like, well, you said to do this and you said to do that, and it's just so annoying. So I write very detailed notes. I'm like, patient said this. I said this.
Wow.
Patient said this.
You don't wanna...
Right, and I don't want to, because I remember the conversation, and I know that I talked to them. I know that I gave them the different options. But sometimes, in dentistry, how it works is if you didn't write it down, you didn't say it. So if you said, well, I explained the treatment plan, they understood, they knew what they were getting into. If you have to go in front of a judge or one of our, what are those called when they
ethics committee, okay,
right? Like they're just like, well, let me see your chart notes. Did you document that this was discussed? And you didn't document it, then the patient is more likely than not telling the truth, unless you can prove it like another way. Okay. So you got to document. But nonetheless, I think that's the most challenging part.
Herodontics.
Yes.
That's interesting. Interesting. Herodontics. Okay. Well, so you said work-family balance, and herodontics, meaning, patients may blame you after, or you have the dream to do more, but then you want to save their tooth. You may go to the extra level, and then they're not really appreciative. Right. And sometimes they don't even care as much about their own teeth as you do. Right. Yeah, that sounds like a science professor. Yeah. Like, they don't care about their grades as much as you do, it feels. All right, so what's the favorite part of your career? The favorite part? Because of just working with patients and meeting new people, this job that I'm in now is a new one. I took some time off, and that's another plus about dentistry. I have, in between the children, I've taken off a year and a half here and there, just to give them some time with mommy. And by God's grace, as you met Howard, he was willing and able to just, we tightened our belts, did what we have to do, and I was able to take the time off. But so this current job that I'm at, it's a fairly fast-paced office, so I get to meet quite a few people, and you get to talk one-on-one with them, because
but one of the things that they deal with being in the underserved population is that they just come with stories. Like I had a patient the other day that came in and he was just like, my meth use has gone up. And because of it, I just don't remember to brush my teeth anymore. So of course I'm starting to see new cavities and seeing signs of him not brushing his teeth. And I'm just like, so I told him that I'm going to take it personal if he doesn't brush his teeth and get any more cavities. Because
maybe come off the meth.
I did that too, but I figured maybe that would be a backdoor way to say to him, you need to take care of yourself. This meth thing obviously is not working out. Yeah. So it can be a little bit, touching and heartbreaking. I had one patient one time when she came in, I was getting ready to work on her and she just started crying and I'm just like, what's wrong? So I'm listening. Her mom was on her deathbed and her sister had just taken her mom and moved her to a different state, so they couldn't visit her as much with her anymore. And she's like, the reason why the sister moved her is because she wants her money. So apparently the sister is trying to change the will, and so she unloads all of that on me, and I'm just like, maybe we should reschedule your appointment.
How have you changed? I mean, you said you weren't that much of a people person, but then you became a dentist, but this is heavily involved with some of the most intimate people.
Right. God, because I had to, when I got baptized in the church, and I actually got baptized in a Pentecostal church first, and then maybe like a year and a half later studied Adventism and got baptized in the Adventist church. Soon. In a few minutes, okay? Got baptized in an Adventist church. And one of my prayers were, because I really wanted to go out and tell people about what the Lord had done for me. So I asked the Lord to give me holy boldness. And I was just like, I need to be able to talk to people. Like I would be the one to sit in the back of the classroom. I would know the answer, but never raise my hand. And when I got baptized and prayed for that, he gave that to me. So I can talk to just about anybody.
Look at that.
And it so helped.
Even if you're on Facebook Live, like you can.
Yeah. Back in the day, I'd have been like, no. I can't do this. And my husband, Howard, he's usually, something goes down and, we're talking about it. He'll wonder about something. I'm like, you want me to go ask him?
Wow.
And he's like, oh, Simone, it's okay.
Boldness.
Or sometimes he's like, yeah, go ahead.
Yeah.
But that was really and truly a gift from God to be able to just talk to just about anyone about anything. Yeah. And in my field of work, literally they'll bring anything in. Like I got one guy come in and he just lifted up his shirt, showed me his scar, literally from the top of his chest just down to his pubic area where they had to open him up. I forgot what the surgery was. And I was just like, okay, yeah, I'm glad you survived that. And they come with all kinds of things, and and people have to be able to confide in you. It's not one of those professions where you don't have to repeat it, but if you start talking about them around the office and they realize it, then the next time they won't be willing to share with you. And I'm really working on and learning now that you have to really be careful with people and their feelings and just what you say to people, just because you don't know what people are going through. Yeah. And sometimes what you say to them or how you interact with them could be that straw that breaks the camel's back.
Yeah, they don't teach us that when we're taking organic.
No.
We're taking organic chemistry 1 and 2 and physics. How much intimacy there is between the patient and the healthcare professional.
Yes.
That's just something that through the Holy Spirit, He's gifted you to be able to change and deal with, because a lot of the times we're focused so much on our schooling and in college and in dental school that we literally can't even think about people. Right. But then once you start getting into the field, God can quickly change you to do that.
And I think He prepared me for being able to be in this profession. Yeah. And I mean, pediatrician, my focus changed from pediatrician along the lines. I don't know if we'll talk about that.
Yeah, just talk about that. With the last question. So, why did you wanted to be a pediatrician? Right. How did you become the dentist? As I said before, I think dentistry is the best kept secret I think it's much better than medicine. That's just my opinion. Yes. I'm going to talk to a couple of doctors in the next weeks. Damaris and Kina, you're going to have to change my mind on this. But okay, how did you shift? What made you say, okay, no, I'm not going to be a physician, I'm going to be a dentist?
Right. Well, one of the things, and it's kind of a gross story, so I won't give all the details, but I went to VCU, Virginia Commonwealth University, for undergrad, and I ended up going to their dental school as well. But they had a program called 4U, where a fourth-year medical student would pair up with an undergrad pre-med student. And they took us on rounds and they showed us just what medicine had to offer. So
take a pink. I forgot to tell people your bio. So number one, you got a bachelor's in biology from where?
VCU.
From Virginia Commonwealth University, and then
went to dental school at VCU as well.
So you stayed and went to dental school there.
Right. So I took a year off in between, and then I did a 1-year residency, general practice residency at Jacobi Medical Center in the Bronx.
In New York.
Okay. Right.
All right, go ahead. Continue your story.
So we went on one of these rotations, and it happened to be the gynecological rotation. And the lady was doing her thing, trying to show us how to find the ovaries and so on. And she was having her cycle at this time, and I was just like, that does not seem normal.
This is not right. This is not normal.
No, I was like, I don't want to do that.
No, me neither. I don't care how good I am in bio. I had a 3. Well, I'm not gonna talk about me. Right. But I was great in bio, great in chemistry, great in organic, great. And I said, nope, this is not me.
Yeah, and I was just like, I don't want to. And she was like, what if you put the ovaries are? I'm like, nope. Thank you. And then
no Dr. Huxtable for me. I know I wanted to be Dr. Huxtable, but never mind.
Yes. And pediatrician was still a love for me, but I was like, can I get through medical school without doing this rotation? And they were like, no. So I was like, okay. So then the following, I think I ended up graduating and decided to ended up taking a year off, but I went to another program called HCOP, which is Health Career Opportunities Program. And with that program, they showed us all what the different health careers had to offer. Okay. So they had, physical therapy, they had medicine again, they had dentistry, they had everything in the health careers that you can think of, nursing, of course. And showed us a little bit of it. And then we also got to take a couple of classes, some of the intro bio classes that you needed for medical, dental, and all that. And I met a young lady by the name of Sharon Jefferson, actually. And she was already in dental school. She was starting that next fall. And she was just like, she told me all of the wonderful things of dentistry. And she was like, why don't you just try being a dentist? One of the beauties of it is that, you get to have a family and you can do your career as well. You can do as much or as little as you want.
This chick was working sometimes part-time and making more than me, okay? Let's just keep it what it is. You can work part-time. A dentist can work part-time.
You can.
Take care of their family, work part-time, and still make more than the average person. It's crazy.
It's definitely possible. Working for a not-for-profit is not necessarily the way to do that, but it's definitely possible. But she definitely influenced me a whole lot to make the decision to change. And even when I was in dentistry, I was thinking, well, I wanted to do pediatric dentistry.
And you did?
I worked as a pediatric dentist, but I didn't go to school for pediatric dentistry. So that's the fun part or the beauty of being a general dentist, because like I said, you could tailor it to whatever you want to.
I forgot that you were doing pediatric dentistry
for like 5 years. And one of the reasons that I decided to do pediatric dentistry, I was just like, the adults cry too much.
That's funny.
They would literally sit in the chair.
The adults cry too much. Yes. Oh my gosh.
The children, I can so understand why the kids are crying.
Right.
I'm gonna give you a shot, and it's likely to hurt. So you have reason to cry. But the adults would sit in the chair and they would start boo-hooing. What are you crying for? What is your problem? So the Lord was still working on me that compassion part and just, but the nice thing about having worked in pediatrics for 5 years, I got really good at giving shots. So most of my patients, I give them a shot, and half the time they don't know that I already gave them the shot. Wow. They just feel like they start getting numb and they're like, really? You already did it? I'm like, yep. So that's been a huge blessing. And then again, working and just how the Lord has just been working and putting things in place, working with the population that I work with, they've, had some trauma over their life as far as, whether it's a dentist in their childhood that treated them rough or a dentist, the last year that they went to that just was really rough and just, I'm gonna give you this shot and take this tooth out, whether you're in pain, they've just had some experiences. So when they come in and I see them, it's just like so, and I think that's definitely a blessing from the Lord that he's using me in order to work on these people and help them to be calm and understand that it doesn't have to be this crazy, painful process as to why, getting your teeth worked on. So it's been a plus. There's
also some differences in terms of dentistry and in the way you are billed and politics involved, right? Can you talk a little bit about that?
Yeah. With dentistry, we govern ourselves. So the ADA takes steps to make sure that, just all across the board, the dentists are in line, for lack of a better way to put it. They try their best not to have the government, so to speak, coming in and telling the dental field how to do things. So they make sure that they govern themselves, so this way we can have the control over our profession and no one else has to come in and tell us how to or dictate how to do things or when to do things. So if there's any kind of mediation that needs to happen, they have all that stuff set up where it's taken care of. And if someone is out of line and they need to take licenses, they will take your license in a heartbeat if you're ill-treating patients or if you're, if you're messing with Medicaid, do not mess with Medicaid as a dental provider. They will get you.
They will get you. Yeah.
Yes, they will.
So they're better, and I'm not gonna say better, but
they're really good
at managing dentists and making sure, because you never hear like not that much. I don't hardly hear about malpractice in dentistry and
one or two cases that I've heard of, but there's not too much of it.
And so your insurance is probably not as high as, I think obstetrician gynecologists are probably the highest in malpractice insurance. We're actually going to talk with OBGYN. So I'm not railing on the OBGYNs.
No.
They're gonna have their say.
Against any other profession. It just wouldn't have worked out for me.
Yeah, dentistry. I think that if I didn't do what I was doing, I think if I wanted to be a medical professional, I would have been a dentist.
You'd have had fun.
And so what you do is you do the same things for medical school. Instead of saying the MCAT, you take the
DATs,
the DAT. And then, do they have residency in dentistry?
They do, because they have 9 specialties.
Okay.
So the highest one is oral surgery, and I think that's 3 to 4 years. Again, so you do your undergrad 4 years, and then you would do 3 to 4 years of oral surgery. Pediatrics, I think, is 2. We have periodontology, which is the gums doctor. That would, if you have, when they say you have gum disease, that's who you would go to. And I think theirs is 2, maybe 3 years. Then you have orthodontist. That's a separate specialty as well. So if you want to go into dentistry and you don't want to ever see blood or take teeth out or do anything, go be an orthodontist, because they don't do any of that. They send it elsewhere. They just straighten teeth and align things, and that's what they do. And I think there's even pathology. So if you want to just stay focused on the pathology of ear up, pretty much, or mouth, you can be a pathologist. So there's quite a few different options that you can do as a dentist. And if schooling, you only want to do your 4 years, whereas with medical school, I think medical school, it's required for you to do a residency. A dentist can do their 4 years and just be done and go start a practice right away.
That's what it is. I feel like you do have residencies, but you don't have to.
Right.
and you can straight up just start your own practice, which many people do. They partner in practices,
right, and buy into stuff, and and depending on who you talk to, a person who does a GPR or AEGD, and I think AEGD is an Advanced Education General Dentistry.
Okay.
They'll tell you, yes, you need one, but a person who doesn't do it just starts off after they graduated, you know, just go open up shop or go work with somebody, they'll tell you, no, you don't need it.
Yeah.
So it just depends on who you talk to. But for me, I think it's a matter of comfort level. I graduated and I was pretty comfortable with doing dentistry. So mind you, when I went into dental school, I had never done anything dentistry. Well, I shouldn't say that.
Like no pre-dent program. You like I had friends who were in Oakwood. They did pre-dent clubs and all that stuff. You didn't.
No.
Because a lot of time they said it's about your hands. You know, you have to be good with your hands.
I didn't.
And you didn't do any of that
no,
just to show yourself worthy.
No. I took a year off and I worked in a pediatric dental practice to make sure that dentistry was what I wanted to do. But all I did was polish teeth and did sealants. It wasn't like, you know, I didn't hold a handpiece and, you know, cut anything. And one question that we got, like the first day or the first couple of days that we were at school, the professor asked us to draw what we thought a millimeter measurement was. And in dentistry, millimeter is a thing, you know? Yeah. So we had to draw it and turn it in, and I drew mine and I was getting ready to
like an inch. Was like an inch.
It was probably close to an inch. I drew mine, I was getting ready to turn it in, and one of my classmates was like, oh, that's not a millimeter. And he was trying to tell me the answer, and I was just like, look, this is what I drew, and this is what I'm turning in. I gave the paper in, and of course I found out it was wrong, but I didn't want to start off on. And I understand he was just being nice and trying to help me out, but him telling me the answer was not going to help me anyway to learn this thing properly. So I turned my paper in anyway, and of course the professor was like, yeah, we have a lot of range of what people think a millimeter is. But I was willing to suck it up and say, hey, this is what I really think it is, and I will learn it.
And you will learn. And so you started off behind the ball because you really didn't know, but it doesn't matter.
It doesn't.
You learned.
Yeah.
You had a learning spirit. You had a spirit of learning, discipline that you got from your mom and your grandma. Yeah. And
you will have classmates who have, you know, their great grandfather was a dentist. So they grew up like, you know, and one of the things that we had to do, we had to carve a tooth out of like a block of wax. So they give you like a rectangular.
I remember the pre-dent club, they were doing stuff like that.
Yeah.
I remember that.
So, and we would carve teeth out of that. So if you've never carved anything in your life, you have to learn how to do it in dental school. And you have to build teeth out of wax as well with different colors, and you can't let the colors blend into all kinds of stuff that you have to do. But you know, I had never done it. I didn't have a parent or never even visited a dental office when I was growing up to see what
as many of people of color. Many people of color don't have the access.
Right. So it's still doable, even if you've never done it before. Because if you think about it, they have to teach you everything that you need in order to graduate. Right. You know, because they want to graduate. You know, they're not gonna, depending on the school that I went to was mostly Caucasian. I think in my class there were 6 African American students, and it was a class of 88. If I'm, you know, someone can correct me on that. But that's a little less than 10%. That's classic. That's classic. Right. But they have to teach you everything that you need to know. It's just up to you to determine, you know, whether or not you're going to go to the club or stay home and carve that tooth. So when you take the test, you can do well on it.
Please, ain't no clubbing in dental school. There's no, listen, if you want to make it in
some of my classmates did go to clubs. And they did go to parties and they did drink and they do, you know, some of them do that.
Let me rephrase that. Like I was telling my cousin this, and same thing in medical school, but a lot of the times it is usually after the test, like it's they're crashing. Most of my friends, I would see them. I tell people all this, you know, especially for social justice issues. You want to find somebody who's on drugs? Go to the nearest medical school. Okay, go to that. You know, they want to target these boys on the street with marijuana. Trust me. Yes. Go to the nearest medical school dorm or dental school dorm, you'll find some.
Yes.
Because what happens is you're so stressed, you're taking all these tests, and then they just crash. So yeah, you're right. They do. They do go to clubs and drink and smoke and do that stuff too.
And as Jamaican, I got a lot of. So you never smoke weed? No, I have never smoked weed.
Stereotype.
You don't know where to get some weed?
Stereotype.
No, I do not know where to get any weed.
So they coming to you as a Jamaican, the Caucasian people coming to you to get some weed.
And I'm just like, I can't help you.
Yeah.
So, yeah.
But anyway, so to your point is you may start unprepared, behind, but it is to their benefit, the dental medical, that you get in to that you succeed, and they will do whatever necessary to help you. You have to help yourself. You have to be motivated and disciplined. And if you have that, even if you come behind, like you don't even know what a millimeter is, right? Like I punish my students. My students know what a millimeter is from General Biology 1. They do the DFV. Yeah. But seriously, like I don't remember knowing a millimeter until I started to teach it.
Okay.
You know, so a lot of stuff that we learn in school, we don't really remember it until repetition or you're teaching it to someone. Right. So you may be behind, but if you have the discipline and the motivation to learn, you can be this phenomenal dentist right here. Thanks so much, Simone.
You're welcome.
I appreciate it. I am the phenomenal STEMist, and so is this one right here. Thanks, guys. Hey, Sister Hazelwood, I see you. Have a good evening.
Bye.